morning, everyone. It's my pleasure to be in Singapore to present what I do daily. We use laser acupuncture in our clinic to help our patients to sleep better, feel better, and also to help them to calm, because we do a lot of tongue-guided procedures, and we do need those kids to be calm. I have no financial relationship with any company except my own. So we do end up seeing a lot of kids with ADHD and autism, and of course they do have sleep issues, and we use laser acupuncture to help, but we also use capnometry to monitor their breathing to see whether they're actually breathing properly. Combined with home sleep tests, help us to monitor whether that actually is happening. So this is one of the cases I did on the first day before I came. I messaged the mom yesterday. So, how is his sleep at the moment?
His sleep is every day is different. So he could wake up after 40 minutes, could wake up after 4 hours, and then sometimes he'll sleep the whole night, sometimes he'll wake up every couple of hours and just need constant resettling. Every day is different.
So this morning you were saying what happened?
This morning he had woke up at 5 o'clock in the morning and was unable to resettle, so he's been a bit aggro, constantly he punches himself in the head. Out of frustration, but what the actual reason behind it, I wouldn't know.
So that's also, we just actually finished the phenectomy. You can see he's pretty settled, and when I landed, I messaged mom, and he had the best sleep on first day night. So we do know that a lot of kids with ADHD and autism have sleep issues, and they are quite hard to treat. So Chinese medicine been treating sleep for many years, thousands of years. So by combining acupuncture, we can activate the parasympathetic system and reduce the sympathetic activity. That's another case. This is after laser acupuncture. So we can see it's pretty calm.
Getting upset, he hasn't even started.
And that's what happened when he walked in.
You're getting yourself worked up before he's even started.
How is your holiday going?
You got a footy game on the weekend, don't you?
Oh, really?
You take big tackles on the footy field that hurt more than these.
Usually, maybe we just have one parent. Of course, having parents in the room doesn't help. So he came 2 hours away, so there's no way to send him home. And then, that's the laser acupuncture. So within under 2 minutes, he's willing to start. So these are the acupuncture points we routinely use: large intestine 4, lung 7, PC6, sanjiao 5, heart 7, and small intestine 5. Large intestine 4 is very good for any pain in the head. It also helps to clear the nose. And in functional MRI tests, they found that large intestine 4 and liver 3, stomach 36 has an effect on the limbic system. We use Stanjar 5 not only for neck pain, but quite interestingly, the indication also for tongue stiffness or difficulty in speaking. Small intestine 5 helps to calm the patient, and again, it also helps with tongue thrusting and tongue movement. Lung 7 helps to clear the nose, and of course, Dr. T talked about nasal breathing, how important it is. PC6 helps to calm the mind. Heart 7 helps to calm the mind, and we use Heart 7 a lot for insomnia. We also use battlefield acupuncture on the ear, and that's the acupuncture point we use, those 5 points. There's a multi-center study by Dr. Gan Eldor. They have shown that by using the battlefield acupuncture on preterm babies that require eye examination, they find this pain score reduced, heart rate reduced, and the SpO2 also improved. And these are the babies straight after phenectomy. Very, very chill.
Good morning.
One of the reasons we use laser acupuncture on babies, in the past, we try to use those e-seats. The problem is putting the e-seat on and then trying to take it off while the baby is moving. It's actually a lot harder than laser acupuncture. In order to improve the balance even more, we have a protocol of global balance. So we including some of the points on the legs as well. And you can see in this diagram, all those points actually works together. And one of the chiropractors that worked with me pointed out this article. He said, there's an article actually come out and using very similar points to what you are using for speech on kids with ASD. On this article, they found that using laser acupuncture on those kids with ASD, they are 50 times better at expressive speech, almost 19 times better at comprehension, and 7 times better at social interaction. So very similar to the point that we use for global balance. So those are the points I highlighted there. I won't go through the actual mechanism on the article, but if you want, you can look up the article. The QR code is there, and you can read up how they found about those points actually on the brain. So this is another case of a 4-year-old. He came in after TNA surgery, still having sleep issues and emotional problems as well. So he does have oral ties.
And again, to put the tongue up. Yeah.
And you can see he doesn't know how to move the tongue properly.
And say, again.
So use a large. Okay, right. And that is his CBCT. You can see the nasal surgery, I think, can be better. I work with a good ENT in Sydney, luckily, but he didn't see him. He saw someone else first. His diet is not very good, so our plan was to do some laser acupuncture for him to prepare him for the phenectomy eventually, when his behavior allows us to do it. We also use capnometry to have a look at his breathing. So the technology is to monitor the end-tidal CO2. What we want to see is the end-tidal CO2 above the red line, which is at 35. If the end-tidal CO2 is not enough, it won't carry oxygen into the blood properly, and they won't have proper pH balance. So we use these points for him. In addition, we use GB20 to help him with his breathing. We use a sleep brain to monitor his sleep. So this is his first sleep test. He did have acupuncture before this test. So what we can see, his ANS balance is not too bad, but the REM sleep is not very good in the first night, so only 10%. The second night is a bit better. The advantage with the sleep ring allows us to do multiple nights of study. Second night he got more REM sleep, but the data showing that he may have some apnea. So we can see a lot more REM sleep in this. And then he came back around 2 weeks later. We do some acupuncture, and we can see he can consistently going above 35 in the capnometer. So we repeated the sleep test in preparation for the talk today. We can see not much REM sleep, but not much apnea. One of the issues we're still facing is the ring to still come off. So you can see the ring actually came off after 1:30. So the data is not quite usable. And then second night the same, not much apnea, but we can see the ANS balance looks pretty good. As we know, the REM sleep is usually in the early morning, so we couldn't really know whether he actually had better REM sleep. So yeah, you can see here the ring came off again at 2 o'clock. So hopefully I got invited another time to actually show better data with more patients. So yeah, the capnometer allows us real time to monitor the breathing and educate the patient, try to change the breathing patterns. So it even work on 60-year-old. So this is a patient we saw a few days ago, and so that's the baseline. We can see he's consistently under 35, and after acupuncture, he's a lot better. So since learning about the speech article, we've been doing some more speech area in the head. So for this patient, she does have some breathing issues, some jaw joint problem. That's why we do the jaw joint as well. And after doing the acupuncture, we can see this is before. She's not very consistent with her breathing, even though she's above 35. But after acupuncture, you can see a lot more regular. So there's definitely some effect on the autonomic system. So with laser acupuncture, we find that we're able to do acupuncture without needles. It's pretty quick and also help with challenging patients. It's a safe alternative and quite easy to do, and there's a lot of evidence in research showing acupuncture to help with sleep, especially for ADHD and ASD population. a lot of parents are looking for this. This is my reference. And final message from AI.
May compassion be your compass, intention your guide. In the space you hold, healing finds its way.
Thank you.
Okay. Well, I know the next speaker we're going to have after the break is Dr. Vanderbeek, so I hope he can keep up with these guys. So, questions for our panel? I have one. Where is laser acupuncture taught?
Unfortunately, not many people teaching it. I am teaching it.
Is Dr. Levine in the room? Okay.
Right.
All right. So thank you for that. Where did you come up with the